So good evening, friends. Meeting again with the Organon, the practical part of the Organon. And now we are turning towards the most practical part of the Organon now. Because now it will turn from the classification of diseases towards the understanding of the diseases in the person. That is the case taking. And before going toward that, there is a one big aphorism. Till yesterday, we have learned this classification of diseases. He has started classification of diseases right from the adynamic to dynamic. Adynamic, where the causes are external, dynamic, where the causes are internal, right from the disturbance in the vital force. And it is when it happens, it used to produce a disease, that is dynamic. He classified further dynamics into two types, the acute and chronic. Acutes are self-limiting disorders, 99.5% pressure, but only in 5.5% they enters into the complication. Acutes, he has divided into four types: the individual, that is indisposition, the sporadic, the epidemic, and the endemic. Out of which the first two, individual or indisposition and sporadic, depends more commonly on the susceptibility of the individual, whereas the epidemic and endemic are caused because of acute myosomes. The concept which Hahnemann have told regarding the bacterial, viral, parasitic cause of the diseases, and which he explained over there. So this is what regarding the acute classification we have discussed. And second important thing which we have started is the chronic diseases. And chronic diseases he has classified into three different types: the artificial chronic diseases, the pseudo-chronic diseases, and the true chronic diseases. Artificial chronic diseases are the result of the chronic bungling with the allopathic medicines, long-standing use of the allopathic medication, because of which it has happened. Pseudo-chronic diseases are caused because of the maintaining causes or causa occasionalis, looking or mimicking the chronic disease, but actually they are just result of maintaining cause. And third, the true chronic diseases in the form of chronic manifestations caused because of chronic myosomes. The three myosomes which Hahnemann have explained, two are venereal in origin, the syphilitic, the first one he discovered, second one the psychotic, and third one non-venereal, that is the psoric. The 7/8 of cases during Hahnemannian time, they were of psoric origin, and only 1/8 of were syphilitic and psychotic, out of which 60% were syphilitic and 40% were the psychotic. This is what we have learned, and Hahnemann came to the conclusion that if you treat those chronic myosomes with the help of proper anti-miasmatic remedy, so it depends. If the patient is psoric, then you have to give antipsoric remedy. If the patient is psychotic, you have to find it out antipsychotic remedy. And if the patient is syphilitic, you have to choose the antisyphilitic remedy accordingly. And that remedy clears up this chronic myosome and recovers that patient permanently to the state of health. And this is in fact the best discovery or invention done by the Hahnemann at that time. So this is what we have learned. Let us go ahead with the next aphorism. That is the last aphorism related with this classification of diseases, the aphorism number 81. So we'll start with that. Just a minute. So aphorism number 81. The fact that this extremely ancient infecting agent has gradually passed in some hundreds of generations through many millions of human organisms and has thus attained it in an incredible development renders it in some measure conceivable how it can now display such innumerable morbid forms in great family of mankind, particularly when we consider what a number of circumstances contribute to the production of these great varieties of chronic diseases, secondary symptoms of Psora, besides the indescribable diversity of men in respect of their congenital corporeal constitution. So that it is no wonder if such a variety of injurious agencies acting from within and from without, and some continually, on such a variety of organisms permeated with the psoric myosome, should produce an innumerable variety of defects, injuries, derangements, and suffering, which have hitherto been treated of the in the old pathology works under the number of special names as diseases of an independent character. See, he explains over there regarding the psoric diseases. There are many varieties of psoric diseases. When the psora is suppressed, when the primary manifestations of the psora, that is the itch, if it has been suppressed, and when it enters into inside, it depends. There is a diversity of men, varieties of peoples are there. And because as the peoples are various varieties of peoples are there, the presentations are variable. Sometimes you get the psora reflected in the brain, sometimes it might be reflected in the your heart, sometimes it might be reflected in the stomach, it might be reflected in the kidneys. It depends upon only the susceptibility of that specific individual, and there it reflects. So many times we get cases where you get the suppressed skin eruption and it directly enters into the brain and produces typical features of the convulsions or epilepsy. And patient never understands how it has happened. There was, I think I have shared this case with you or not, but just I will repeat it. A patient, young lady who has married just 1 year back, brought to me with a convulsion, referred by a physician. And she never had epileptic attacks in 20 years of age. And first time after 1 year of marriage, she had this. And she was first treated by that physician, then she was referred to neurologist. Neurologist asked that she should continue with the medicines, even though her EEG was normal, even MRI was normal, everything was normal. He asked that she should continue anticonvulsant medicines for 5 years. And then that physician, who was quite conscientious enough, sent that patient for homeopathic treatment and asked me whether homeopathy works in such type of case. And then she was referred to me. When I took her case, I asked only one question during whole case taking, that have you suffered from any skin problems in last 1 or 2 months? And immediately she reflected, yes, sir. I had 15 days back, I had a severe fungal infection in groin, and which was treated with the some ointments prescribed by the skin specialist. And because of that, it has vanished. And that reflected in her brain. So this is very important thing which was there. This is what Hahnemann said. This is what Hahnemann explained. So this is suppressed skin eruptions leading to form directly an epilepsy. Remedy was very clear with my mind. I was damn sure that it will bring back again those eruptions. I want that patient that if I will give medicine, your skin eruptions will repeat. And if it comes, don't apply any medicine. Don't go to skin specialist. Do come to me and I will treat that later. But first important thing that it is better. It will be better if your eruptions comes back. We have not started her anticonvulsants because it was not needed. I was knowing that this will reflect back. And I have given the Zincum metallicum to her. After giving Zincum metallicum, 3 doses followed by the placebo, and I asked her to come and meet me after 15 days. But she returned only after a week. With same complaints, she has started getting again eruptions in the groin with the similar manifestations as it was there. And this, when it came back, thereafter she never had a convulsive attack. It is nearly about 10 years have been passed now. She never had a convulsive attack. So it was again, it again reflected and came back to the normal, to the primary manifestations of the psora in the form of skin eruption. So those skin eruptions, when reflected back, I reconsidered her case at that level, and again I prescribed remedy to her. After that, within span up to 3 months, gradually that tapered and vanished internally. And when it has vanished, till today, she never had second attack of epilepsy. So this is how it turns. This is what Hahnemann explained. And this is what Hahnemann wants to explain. This is the secondary manifestation of the Psora, which gets reflected anywhere inside the body. Yesterday also I have shared a case, a follow-up of the nephrotic syndrome because of suppressed skin eruption. This is quite common, and this is too important. So you must know all those things. These are very essential things. If the rheumatism happens to be there because of that, you must think of the dulcamer also. And those remedies bring back again the primary symptoms. And then if the primary symptoms comes again, then the secondary symptoms disappear. The chronic secondary disease, which is developed because of the suppressed skin eruption, again settles and brings back the primary. And this is what Hahnemann is explaining, that there are varieties of the secondary symptoms. It varies from person to person. There are many more presentations of the Psora, and that's why he labeled Psora as a hydra headache. If you suppress skin eruptions, it might produce anywhere its own head. It is not fixed that it will turn to the GIT, it will turn to the kidneys, it will turn to the brain, it will turn to the lungs, it will turn to any specific organ. It is not so. It depends upon the susceptibility of that individual, and it goes over there. And this is what one has to understand. And I have seen n number of times in my practice, it reflects like this. When I was just a junior, means I was just started my practice early in my practice. I was doing my practice along with my father's practice. My father was a doctor and he was doing general practice. So I have to see his patients also, and I have to go with the homeopathy also. And there was one patient who used to come to take insulin towards him daily in the morning at 8 o'clock. So he was coming. So when I came here, my father said, now you look towards those patients. I will not go to the OPD. And I started looking towards those patients. And what happened? One day, he told me, Doctor, see, these are the eruptions which developed over there in my hands and feet. What to do? I said, don't do anything. Because his age was nearly about 80. It was senile eczema which was appearing over there. I said, if you feel more itchy, just apply coconut oil, keep it moist, nothing else you should do. He said, how it looks, it never looks good. I don't want it by any means. I explained the things to him, but he never listened. The next day, he went to a skin specialist who used to come right from Pune to Sangamner. And he has prescribed local steroid ointments along with internal steroids. And next day, the patient came, yes, doctor have given me this and this medicine, and see, change. Yesterday only I applied the ointment and it looks very good. I said, it's okay, but it will cause trouble. He said, how can it be? And same day, he had a myocardial infarction. It has entered directly into the heart. He survived luckily, but I told him that, my dear sir, it is necessary to bring back those eruptions. Don't use this if you want to save your life. And thereafter he listened. Yes, sir, I will stop using this. And thereafter, when it returned back, he survived. He survived nearly about 10 years later. So this is how what Hahnemann have explained over there is everything is very, very experimented. And this he wants to explain in front of you. There are varieties of presentations which are there. There is a big footnote to this paragraph. And that footnote, I think there are two footnotes to this paragraph. Both of them will read. Out of these, second footnote where he had used one paragraph completely in German, that will not going to read because I don't read the German and know the German. But the first footnote, first 78 footnote will start with. Some of these causes that exercise a modifying influence on the transformation of the Psora into chronic diseases manifestly depend sometimes on the climate and the peculiar physical character of the place of abode. Abode म्हणजे घर करून राहणं, to reside inside. sometimes on the very great varieties of the physical and mental training of the youth, both of which may have been neglected, delayed, or carried to excess, or on their abuse in the business or conditions of life, in the matter of diet and regimen. Passions म्हणजे तीव्र भावना. Passions, manners, habits, and customs of various kinds. See, this footnote is related with the word number of circumstances. When we consider that number of circumstances contribute to the production of these great varieties of chronic diseases. These are different circumstances which he has mentioned over there. And these are the circumstances which leads towards the psoric manifestation. These are the expression, these are the causes, exciting causes behind the expressions of the psoric miasm. Many a times it is excess of the food. Many a times it might be a change in food habits. It expresses in the form of some severe passions. The person is tremendously irritable. Sometimes he is absolutely angry. Sometimes it might be depressed. Sometimes it might be he might be disturbed because of change in his daily routine. All those things which are the exciting causes behind this Psora, which was there inside hidden. And these manifestations comes out because of all those circumstances. It depends upon the circumstances. And many times circumstances plays a very vital role in your life. Everything is going on fine, and all of a sudden something happens in your life. That is sufficient to bring back and stimulate the Psora which is hidden inside you in the form of a latent Psora, which excites that, and the disease is expressed. It depends upon your susceptibility of the organs which is susceptible, and accordingly it reflects. So it is not specific that it will reflect in a specific manner. The circumstance might be similar for 10 persons. Manifestations varies according to individual. In one patient, that same circumstance will produce the brain problem. Another patient, the same circumstance might produce just a headache. In third patient, it might reflect some nasal problem. It varies from individual to individual. And that's why here both things you have to take into consideration. You have to take into consideration the cause as well as effect. And this cause and effects gives you exact individuality of that individual for whom you have to find it out the right remedy. So in this paragraph, he wants to explain which are the circumstances which are responsible to stimulate the Psora, which is hidden inside. And one more footnote is there, which is related to the nomenclature which is given in the allopathy, or different pathological names given to the diseases. That is old pathological works. Regarding that word, the 79 aphorism is there, footnote is there. See what he says in footnote. How many improper ambiguous names? Ambiguous म्हणजे एकापेक्षा अधिक नावं दिलेले किंवा खूप मोठे मोठे नावं वापरलेले. How many improper ambiguous names do not these works contain, under each of which are included excessively different morbid conditions, which often resemble each other in one single symptom only, as ague. Ague means, what is an ague? AGUE. Ague is nothing but the malaria-like, influenza-like symptom. Jaundice, dropsy, consumption. Consumption is the word which is used in this literature as a tuberculosis. Consumption शब्दाचा अर्थ क्षय होणं, आणि म्हणून आपण tuberculosisला मराठीत we used to use the word क्षयरोग. So consumption, leukorrhea, hemorrhoids, rheumatism, apoplexy. What is apoplexy? Apoplexy is congestion to the brain leading towards the paralysis. Convulsions, hysteria, hypochondriasis, melancholia, mania, quinsy, palsy, etc., which are represented as diseases of the fixed and unvarying character, and are treated on account of their name according to determinate plan. So in allopathy, these medicines, these disorders are considered to be a separate disorder, and they are treated according to their names. But when they are treated, they are not cured. They are only and only palliated. So this is too important to understand. If a patient has had epilepsy, they used to treat that epileptic patient continuously and they just go on palliating. It never cures that patient. That is very important to understand. It never cures. So all those rheumatism, they palliate the rheumatism. If paralysis is there, they used to give medicines which keeps that person as in a palliated form. So whatever may be the chronic disease which is reflected out of this suppressed skin eruption, there is no cure, but there is a palliation. But what he says further, how can the bestowal of such a name justify an identical medical treatment? And if the treatment is not always to be the same, why make use of an identical name which postulates the identity of the treatment? See, here he explains that giving a nomenclature or using name to it, how it is useful, because you give very close names to them and accordingly you treat that patient, and you don't treat that, you just palliate the thing. And why do you give, why do you label? Instead of that, why don't you listen what he wants to express? Why don't you want to listen what patient wants to tell you, the subjective feelings of the patient? Because those subjective feelings will guide you towards the right remedy, and this never happens when you do with the allopathy. So if the patient of rheumatism comes, you start giving him non-steroidal anti-inflammatory drugs. For all patients, the remedies are same. So rheumatism, it might be of any variety. They used to prescribe one and same medicine. If it never works, the another molecule. But again, analgesic. The third molecule, it is, if it is not working, the steroids. And this is the common. And that's what Hahnemann wants to explain, that how can it be? They are the products of Psora. And if they are products of Psora, expressing his individuality in the manifestation, you find it out the similar remedy, which is antisoric enough, and cure that patient. There is next paragraph, which is in German, so we'll not read that. And we'll go with the next. As says Huxham, a man as clear-sighted as was estimable on account of his conscientiousness, and in like manner, Fritze laments that essentially different diseases are designated by the same name. Even those epidemic diseases, which undoubtedly may be propagated in every separate epidemic by a peculiar contagious principle, which remains unknown to us, are designated in the old school of medicine by particular names, just as if they were well-known fixed diseases that invariably recurred under the same form as hospital fever, gay old fever, camp fever, putrid fever, bilious fever, nervous fever, mucus fever, although each of the epidemic of such roving fevers exhibits itself at every occurrence as another, a new disease, such as it has never before appeared in an exactly the same form, differing very much in every instance in its course, as well as in many of its most striking symptoms and its whole appearance. He is explaining that there were names given to this epidemic. They keep the same name. Even recent example is the COVID. We have given name COVID-19, and COVID-19 has changed its presentation every time. Every 6 months, the presentation was different. Today, the presentation is absolutely different than the 2 years back. And still, the name is same. Treatment, the investigation method is same. And now you give the different names to the same virus, because the virus has changed its own structure, and you now label them with different names. And the treatment used to remain the same. This is something different. Hahnemann never wants to explain this. Instead of that, what is the presentation of the patient that you have to take into consideration? So first epidemic which came 2 years back of COVID-19, the presentation was rather affecting his most vital organ, where lung was getting involved, along with the vomiting, along with the gastroenteritis, along with the whole torpid conditions of the human being. And that's why at that time death rate was very severe. So this is how it changes. Then after 6 months, it has changed. And these things still they consider the same name, and that even though the presentation is very, if it presents in a different manner, you have to take into consideration the totality and find it out a right remedy for that specific presentation. Each is so far dissimilar to all previous epidemics, whatever names they may bear, than that it would be derelict, dereliction म्हणजे कायमची हयगय निरुपयोगी of all logical accuracy in our ideas of things, were we to give these melodies that differ so much among themselves, one of those names we meet with the pathological writing and treat them all medicinally in conformity with this misused name. The candid Sydenham alone pursued this when he insists upon the necessity of not considering any epidemic as having occurred before and treating it in the same way as another, since all that occur successively, be they ever so numerous, differ from one another. And he gives the example, yes, Sydenham explained that every new epidemic which appeared thereafter, even though it looks similar, it has a different strength, it has different presentation. So don't label that epidemic with the same name. Just find it out what its symptoms are there and accordingly find it out the right remedy for the case instead of giving the same line of treatment. Next paragraph, totally in German, will keep that as it is. We'll start with next paragraph. From all this, it is clear that these useless and misused names of the diseases ought to have no influence on the practice of the true physician, who knows that he has to judge of and to cure diseases, not according to the similarity of the name of single one of their symptoms, but according to the totality of the signs of this individual state of each particular patient, whose affection it is his duty carefully to investigate, but never to give a hypothetical gaze at it. If you label a specific name to those epidemics, then the thought becomes fixed. You become rigid in treatment. Hahnemann says, don't label epidemic. Instead of that, just find it out what is wrong with the patient. Just take out the totality. Find it out what is the characteristic totality of that patient and just find it out a right remedy. Don't use or misuse the names because those used names produces misused treatment in the patient. And that's why it is a caution given by Hahnemann that labeling a disease and treating the disease on the names you should not do. And to conclude that footnote, he explains in the last paragraph, if, however, it is deemed necessary sometimes to make use of names of diseases in order, when talking about patient to ordinary persons, to render ourselves intelligible in few words, we ought only to employ them as collective names and tell them, example, a patient has a kind of set viscous dance, a kind of dropsy, a kind of typhus, a kind of ache. But in order to do away once for all with the mistaken notions these names give rise to, we should never say he has the sandwich dance, the typhus, the dropsy, the ache, as there are certainly no diseases of these and similar names of fixed, unvarying character. So he gives a caution that you should not label the disease. And labeling disease is sufficient only for the purpose that if you are talking toward the patient's relatives have a habit of asking you from what disease my patient is suffering from. Then you have to tell them a certain name. For that purpose, it is necessary. But still, if you are talking to him, you instead of defining it directly, he has Saint Vitus's dance or he has a typhus, you said a kind of Saint Vitus's dance, a kind of typhus, because every typhus is different, every epilepsy is different. And that's why you should not label directly with the word epilepsy, a kind of epilepsy. This is better because every epilepsy is a different and it has a different presentation. And if you use such terminologies, you will never fix with the fixed line of treatment in your mind. You will think according to the presentation. and you get a right remedy at that time. And you never get a fixed idea which happens to be there. And those fixed ideas can create a problem. So one must understand all those things before treating. So here completes the classification of diseases totally. So right from aphorism 72 to 81, we have finished the classification of disease. We understood the all those things, and it is necessary to treat the patient, to understand the patient. This classification helps. We have learned each and every aspect of it, and now we have to turn towards the most practical part, that is dealing with the patients, that is case taking. And this case taking, it will take a rather long period for us. My suggestion to all of you, and that don't miss next few sessions, because not only few sessions, many sessions will be there on one aphorism also, and those are more practical. Ask your friends to join. Those who are interested, ask them to join our this session 6 o'clock, so that they can learn this practical session right from aphorism number 82. So tomorrow we'll start with the next aphorism, that is aphorism number 82, and we'll start with practical part. So thank you being
Good
there,
evening, sir.
everyone. Yes, Jyoti.
Hello.
Uh,
Good evening, sir.
good evening.
Sir, I have a case to discuss. May I?
Hmm?
Sir, I have a case to discuss. So may I?
You send that case to me directly.
Okay, sir.
That will be better.
Okay, okay.
Yeah.
Okay.
Any,
Thank you, sir.
if any question related with this or related with topic are there, just we can have a chat.
Hello, sir.
Okay.
Hello,
What?
sir. Good evening. I have a question.
Hmm?
Sir, in treating chronic miasmatic diseases,
Hmm?
if patient don't have any history of suppressed skin eruption,
Hmm?
then while treating, how to trace whether we are on right path or not, or
Basically,
there are chances,
hmm,
to get skin eruptions, although it is not present in past.
many a times patient doesn't know the past history. That is basic thing. In childhood, if anyone had a skin eruptions, he never had a memory that he had skin eruptions. That is the first important thing. Second important thing is that it might be inherited from the past generation. So there is no family past history of skin eruption suppressed, but it was suppressed to his parent. And that also we don't know, because we never had that in our case taking many a times. If we give a remedy to such a patient, for example, we have started with the case and child is only 2 years old age, and we have started with the treatment for such a grave disease, for example, kidney disease. And after giving the medicine for that kidney disease, if he is improving generally, and if directly there is a skin eruption appeared, if the generalities are improved for what the patient was suffering from in the vital organ, now that is improved and it is reflected on the skin. It always reflects, yes, you are on right track. Finished. You have understood that it is the right track. The eruption should be very typical. It should be of a vesicular type. Papillovesicular type should be there. Those are the eruptions. If there is a vitiligo developed, you are on wrong track. That also we have to learn. So that part we'll discuss in tomorrow's session also, because very few seconds are remaining. I will let you know in tomorrow's session. Okay. Thank you very
Okay,
much
sir.
being
Thank you.
there. We'll
Thank you.
meet tomorrow.